In this video, I want to describe what I think patients should know going into surgery for a chiari malformation. So once we've made the decision to undergo surgery for the chiari malformation, let's talk a little bit about what the surgery entails. Surgery is done under general anesthesia, and the patients are positioned with the face down. The incision is in the back of the head. So there's a bump on the back of your skull called the inion, and then there's another bump that most people can feel, which is a little bit below that, which is C2. And the incision goes from the inion to C2. We do shave a little bit of hair in the back of the head. Once the incision is made, we go down to the back of the skull, and we remove part of the skull called the suboccipital bone. You wouldn't actually feel this bone because it's tucked up underneath the muscle, but we do remove a small amount of bone. And I'll usually remove part of the C1 arch so that we have enough room to do the surgery. We then open the covering of the brain called the dura and stitch it back. And then we explore the area. We make sure that the tonsils are out of the way, and sometimes we'll shrink them back. And then we make sure that the spinal fluid is freely flowing again. I then sew a patch into that space, and that enlarges the space permanently and allows for spinal fluid to freely flow and gives the back part of the skull and that area of the brain plenty of room to function. And then we close the wound. What are some complications or problems that we commonly see after a chiari surgery? One issue is nausea. Patients are typically nauseated after surgery. We give medication before surgery, and then we really want to avoid narcotics as much as possible after surgery because that can exacerbate the nausea. Fortunately, the nausea usually gets better in 2 or 3 days. Patients also have pain related to the incision and the muscle dissection. I think the pain is primarily a muscle spasm phenomenon. So ice and a muscle relaxant is maybe the most effective way to treat it, and it also avoids the complications of the narcotics. Another medication that we commonly use is Toradol and an oral version, Celebrex or ibuprofen. And these are non-steroidal anti-inflammatory medications that are quite effective for the pain and also don't make the nausea worse. We do run into some incisional related issues, the number one being spinal fluid leak. So we've sewn in this patch and we want the body to seal it off completely. Sometimes spinal fluid will leak through the patch and cause some swelling at the incision site. You can help prevent this by avoiding straining, coughing, sneezing, and bearing down to have a bowel movement as much as possible. Also, if this swelling occurs, and especially if there is drainage of clear fluid through the incision, that should be something that you alert your provider right away. Longer term, the patients can have some neck pain and headaches, possibly related to the dissection of the muscle and ligaments and relative instability of the area. And I think it's important to work with physical therapy after surgery and engage in some daily stretching and strengthening exercises to keep the area functional. Hopefully that's helpful. Chiari malformation surgery can be very scary. It is a craniotomy. We are working around some critical structures. Fortunately, the complication rates are fairly low, and the surgery is relatively straightforward, and most of the patients experience significant improvement of their symptoms after surgery.